Chicago with an 18-hour flight. It's also a very beautiful city with lots of art and culture. I did my undergrad at University of Chicago on a very Gothic campus. Um, and then recently I moved to Arizona after driving for like a week. Um, so far, loving it. It's really gorgeous with cacti. And this is for those from Kenya, the building on the bottom right, that's our medical school building. And then we have a lot of mountains behind it. So that's my favorite thing, mountains. Um, and then, so the background about this paper, I think most of you probably already know, there's still a very large unmet need for surgical care in lower and middle income country, despite decades of surgical mission trips, humanitarian volunteerism. And the traditional model for this problem is just surgical mission trips, in which surgical teams travel to a lower middle income country together, and then they perform surgeries for about a week, and then they return to their home countries after. Although this is very effective in providing a high volume of surgical care to a lot of patients during that trip, surgical mission trips do not inherently promote surgical capacity building. Once the surgeons leave, the country is still just left with what they have before the surgeons came. Um, and there's also an issue with adequate follow-up after the surgeons have left. So a, a a more sustainable model would be to promote surgical capacity building, teach them how to fish themselves so that the country can become sustainable and independent medically in treating and also meeting this large need for surgical care. And the paper discussed a notable example. Dr. Mustard, a Scottish plastic surgeon, after discovering that there was no trained plastic surgeon in the entire country of Ghana, he established a training program for plastic surgeons in Ghana in the 1990s, which ultimately led to a dedicated plastic surgery and burn center in the country. And so that's like the ultimate goal of this organization to help the country become medically independent in treating a specific surgical condition. So there's no more need for future recurring surgical trips. And then the background about this organization called Research is that it's founded in 1969 by Dr. Donald Lobb, chief of plastic surgery at Stanford. The initial goal was to help underserved children in Mexico, and he established a program to provide surgical care regularly in a charity hospital in Mexicali, which is a border city between California and Mexico. So the story behind this organization initially is also just the traditional model of surgical mission trips. But however, recently this organization is trying to transition to have more training educational programs. So you see in the the darker hexagon here are the traditional surgical care trips. Um, and the yellow hexagons are what they're trying to implement with the different curriculums, training programs, and visiting educator trips to foreign countries. Um, so they're trying to use a multifaceted approach with different components to help trainee surgeons in lower middle income countries who are seeking proficiency in reconstructive surgery. Um, and one big component is their online curriculum. So this is just a screenshot from the website. They cover a whole spectrum of reconstructive surgery and associated perioperative care. These lectures are developed by experts from different specialties and regularly updated. They're open source, and anyone from lower and middle income countries can access them. The procedures and supplies in these lectures also reflect the use in the resource limited setting, so they know what surgeons in lower middle income countries have access to. So the lectures are tailored towards their ability and their resources. And another big component is called a visiting educators trip. In these trips, a group of visiting educators, go into a middle and or lower income country host program. So this is similar to, I guess, a mission trips makeup, with 1 to 2 surgeons, one anesthesiologist, one sometimes with a pediatrician for cleft surgery, or hand therapist for hand surgery, and a nurse. So all of these people will teach their counterpart at the host institution to ensure quality perioperative care. I guess the main difference between a mission trip is that this trip will have much lower surgical volume because the primary focus is to teach the local surgeons how to operate. So they will be operating together with their host surgeons, just like the apprenticeship model we have in the US residency. Um, so the most important thing is to identify host institutions in the beginning, and they're identified by a demonstrated need for reconstructive surgery in a specific country. And they also require host surgeons to be very invested in building a long-term collaboration because that's what they need to actually produce competent surgeons. It requires a long-term commitment. And then the initial vetting process is quite extensive with in-person site visits as well by the NGO staff. And this process, they say, can take many years to fully establish. And each collaboration is guided by a signed memorandum of understanding. Um, the highlight of this surgical visiting educator trip is the demonstrative surgical cases. Sometimes the host surgeons would actually save high complexity cases for the visiting educator to come to maximize the education time and then interesting cases. And they would just cooperate together, like the apprentice style in the US. So, and the necessary medical equipment for this visiting educator trip is also typically provided by the host hospital, because ultimately those are the tools local surgeons have access to. So, they're trying to ensure that everything they teach will ultimately be useful by those local surgeons. And lastly, things you learned in the OR will also be reinforced by didactic lectures um, provided by the visiting educators. So between 2014 and 2017, which is the study period analyzed by this paper, they have done about 38 visiting educator trips in all continents. Yeah, very cool. And then another highlight of this um, paper is that they um, designed a formalized way to track surgical competency among its trainees. So the local surgical trainees are directly observed by the visiting educator during operations, and the visiting educator would rate their overall performance using a standardized milestone metric. And there's about 6 big categories, and with numerous sub-modules. The trainees are evaluated by their understanding of surgical indications for each specific submodule. During preoperative patient evaluation, their ability to perform in the operating room, technical abilities, and their postoperative management of the patients following the surgery. And if we just zoom in on one thing, cleft lips surgery, each training is evaluated on a scale from 1 to 5, and the ratings are standardized across all subspecialties, such that with the rating of 3 indicates that training is capable of operating independently, 4 indicates the ability to train others, and 5 indicates that training is an expert of the specific submodule. And also in the study period, they were able to evaluate 149 trainees in total, and they performed about 377 distinct submodule evaluation. And then this is like the progression of one example trainee. For example, when they first met this trainee, they were assigned a score of 2 in terms of face and neck reconstruction. But a year later and 1.75 year later, their score steadily improved to 4, but dropped to 3. So this is also the way this organization tries to identify surgeons who are competent in performing reconstructive surgery after all this training, and would eventually attempt to collaborate with those competent surgeons as outreach partners. So there's 2 former trainees who become outreach partners with this Research International NGO. This is the implementation of this milestone tracking. Outreach partners, they provide free reconstructive surgery independently to underserved patients in their countries. And research, international, and other partnering NGOs would provide financial reimbursements for the operating cost in order to promote the practice of pro bono surgery, which I think is kind of an interesting concept. And I wonder if they actually stop reimbursing the local surgeons for providing surgical care because I imagine this model of reimbursement wouldn't be that sustainable long term um, if they're able to build up capacity significantly. And then, yeah, this is outreach partner. Okay, and then one last component of this is grant rounds, online grant rounds, where all trainees from all different countries and experts and outreach partners are invited to attend. In this grant round, outreach partners, trainees can pose pose questions about difficult cases, and it's specifically helpful to have those trainees and outreach partners present because medical teams from developing countries oftentimes have more unique insights on solutions for a resource poor environments when they don't have access to the equipment or um, protocols we have in the US, and they might be able to have more creative solutions. Okay, so this is conclusion. Um, the paper thinks capacity building model can be effective in ensuring long-term sustainability and achieving ultimate medical independence of a country so that there's no longer a need for foreign surgeons to go fly in and then perform surgeries for a week. Um, However, traditional surgical mission models is still important in areas where there's no surgical trainees who are interested in learning the new techniques, or in areas there is no enough support staff to ensure that surgery can be carried out independently in that country. So it's still important and useful right now to address short-term needs in lower and middle income country. And I think that's it. Thank you.
All right. Well, thank you, Stevie. Really appreciate that. And we want to open up the floor for anyone who just has thoughts, critiques, about the paper. We're just open to a discussion to kind of also get to know each other as well. So I'll just open it up. You can feel free to put it in the chat, speak out, raise your hand, whatever is easier. Let's go with Vincent.
Yeah, good morning, everyone. For those folks in Kenya, I'm actually a little bit curious. How does the surgical training look like in Kenya? Is it really intense? How long does it take? If you guys could provide insights on that, that'd be awesome.
Well, I could provide some insights. So generally, the duration of surgical training varies depending on the specialty one chooses. So some specialties like neurosurgery take up to 7 years to complete. And there are some specialties maybe not considered really surgery, but some like OB, obstetrics, sorry, and gynecology take like 3 years. So generally, it depends on what you're taking. And also, sometimes the training is more of student centered or student led. So sometimes, especially for public facilities like the one which we are in, that is University of Nairobi, students are expected to do a majority of the work, and generally lectures just give the quote unquote 20 or 30%. Now, also students are allowed to kind of do other tasks, maybe not relating to academics. So they can also work locums in other facilities as well as land. So for our public facility, it's a bit flexible for them. So when you have these flexible options, sometimes it might take longer to complete a course. Maybe that was supposed to take maybe 4 or 5 years, will take maybe 6 or 7 years. But generally, the duration varies.
Thank you.
I also was curious, for our Kenyan colleagues, if have you ever experienced one of these surgical mission trips? I don't know if you've ever interacted with them, if it was a good experience or bad experience. I know me and Faith actually met at Tenwick Hospital. And so they kind of also have a different model where they have a very well established hospitals and a lot of visiting surgeons and just like integrate themselves with the local teams. I thought that was actually like a really good model as well. But again, just looking to my Kenyan colleagues, have you had experience with this? What has been effective versus not effective?
Hello, can you hear me?
Yes.
Yeah, so I think what works for us majorly, yes, you see in the mission hospitals where the visiting surgeons get to come and train the residents, it works. But also most of the surgeons in Kenya are trained in the universities. For example, the University of Nairobi offers a surgical training program for the different subspecialties in surgery, and it's usually it's a 5-year course, whereby there are a number of surgeries that you're expected to do during their training. There's, I think, monthly assessment during your training. There's also a logbook that you need to fill for the cases that you've been able to operate on, here to assess your surgical acumen. Yeah, so we have the training in the university. Then we also have training by professor, um, which is now the same training program that happens in other, like, let's say, level 5 hospitals that are not like under the universities.
Well, thank you. I didn't know we had any other questions, but I also know I want to be aware of everyone's time. I know we have another presentation to get through. So I'll leave it open for a couple more seconds for any other questions or thoughts. And if not, we can start with our next presentation. So for, I guess for the next paper, who will be presenting that?
That will be John. One.
Okay. If you have a presentation, feel free to share it, or if you're just talking, whatever you have planned, but you can take it away.
Sure, thanks.
Thank you very much for the quorum. And I will kindly take it over. Hope I am visible and I'm also audible.
Yes, we can hear you and see you.
Okay, thank you. Okay, so I'll begin. So I am John Riaki Kwane. I am a human anatomist and currently in level 4 medicine and surgery. And I am an editorial assistant at the East African Journal of Neurological Sciences. Finally, I'm also the scientific director for the University of Nairobi Research Club. So I'll proceed. So today we are going to talk about critical appraisal. And we are going to particularly try and mention the red flags that we can encounter in research. So as an introduction, these are the objectives of our discussion. We are going to see what is critical appraisal. Then once we understand what critical appraisal is, we are going to see the significance of critical appraisal and then try and ask ourselves, if we want to do critical appraisal, before we even go to the steps of critical appraisal, what are the components of critical appraisal? What is the process of critical appraisal composed of? And then after that, we are now going to ask ourselves, if we were to select a certain scientific literature, what are the key questions that we are going to ask ourselves in order to assess the validity and relevance of that research article? And then for our students at the University of Nairobi Research Club, we had shared a paper, and we are going to use that paper to try and see if we can put this knowledge that we are going to get into immediate application. So critical appraisal is a systematic process, and it is used to identify the strengths and weaknesses of a research article. The reason you want to assess the strength or weaknesses of a research article is for you to assess the usefulness of that research article, and also to assess the validity of the research findings of that article. And for you to do that, you will apply certain rules of evidence to that study so that you assess the validity of the data that the study provides, to assess the completeness of reporting that the study has accomplished, and to assess the methods and procedures, the conclusions, and compliance with ethical standards, among others. Now, there are some rules of evidence that you apply, just like is noted in the preceding point, but these rules do vary. There are some studies that usually have inherent bias, and you will have to either tighten or loosen these rules according to the these rules are going to change according to some circumstances, which means it is usually not a fixed bolt. It is a bolt that can be loosened or tightened. Now, why do we have to do critical appraisal now that we know what it is? We want to ensure that healthcare professionals can make informed decisions based on high quality, reliable, and relevant research evidence. The reason we are doing research is so that we can increase knowledge on certain fields, and then we use that knowledge and apply it in patient care, because we are doing medical research. And for you to get well-informed, for you to make well-informed decisions and obtain high quality and reliable research that has relevant evidence, you will need to do critical appraisal. Also, if you master critical appraisal skills, you as a medical profession, you are going to effectively navigate the extensive landscape of literature that is outside there. We all know that some bodies of literature like PubMed, they have thousands of papers. Web of Science, name all of them. They have thousands of papers. So if you wanted to find paper in which you're going to learn, let's say, kidney surgery, there will be lots of them. But if you do critical appraisal, you'll be able to navigate so that you specifically focus on those that you can easily get the knowledge that you want. Now, there are some, in continuing professional development, if you do critical appraisal, this can be a component of the CPD, so that you have already done a medical degree, and now for you to always polish. They usually say that the medical field is usually an ever-changing field. It's not a stationary field. So for you to keep up to date, you have to know critical appraisal and be appraising this paper so that you'll be at par with the knowledge that is recent, and also with current trends. For example, how we perform, let's say, a certain form of surgery today will not be the same in the next month. And how will I know? And I'm here in Kenya. The easiest way is by navigating through literature. And for me not to waste time or resources, if I can critically appraise these papers, I can quickly be at par with the current trends in a certain procedure or knowledge. Okay, now what are the components of critical appraisal? First of all, you start by evaluating the appropriateness of the study design for the study question that the article is posing. Also, you are going to carefully assess the key methodological features of that design now. And then try to see the suitability of the statistical methods that have been used. Then you are going now to see if the interpretation of results is appropriate, and also if there are any potential conflicts of interest. And finally, is the research relevant to your own practice? Now, once you have you know about critical risk appraisal and you know the components, what is it made up of, there are some key questions that you are going to ask yourself. And I will assume that the paper that we were supposed to go through is already sent, because I cannot concurrently project my slides and project that paper. So maybe we can do this concurrently, or I can finish going through the steps and then we go through the paper again. Okay, I'll get guidance on that. Now, there is somewhere that I got some, they had summarized all the steps of critical appraisal into some 10 critical questions. And these 10 critical questions are: number one, you are going to ask yourself, is the study question relevant? Because if a researcher is not asking an appropriate research question, then the very need of doing that research event doesn't have any ground. So the researcher has to come up with a very good research question, so that now he directs what he's going to do as to answer that question, and that is now what makes up the rest of the research. So you have to ask yourself very well, is this study that I'm looking at posing a very relevant study question? And we are going to try with the paper that we're going to use as an example, as to try and now put this into practice. How do you ask yourself such a question? Now, once you have answered that first question, the second question is this study that I'm looking at going to add anything new? Because they say that in research, we stand on the shoulders of giants. So if these days, so many people don't do researches. They are still waiting for that research that is going to be groundbreaking, that research that is going to win them the Nobel Peace Prize. And coming through with that research is the sooner you realize that such groundbreaking research is rare, the better, because it is when you can add very little. They call it you see, for example, they call it should I say what? It is just something that is adding up. So for you to do research, just ask yourself, what is currently known in this field and what is my research going to add? So that it is better even for you to see that this guy did this research, and the research is trying to focus on this type of patients. Then you ask yourself, what if we now broaden the participants, so that now we include not only women, we include men and children. You see, now that is going to add a little by little, and that increment is what is important. Now, the third question is, what type of research question is being asked now? If it is relevant, which type of question is it? Yeah? Is it a question that is now going to make us formulate a very good methodology and come up with a very good research method that we are now going to use to gather data now to answer this question? And then, is that study design, was the study design that is used to answer a research question appropriate? Because once you come up with a research question, you come up, the next thing is to come up with a research design to answer that question. And the fourth question is that study design that you came up with, is it appropriate for the research question? And if you are critically appraising an article and you have seen that they have posed a certain relevant question, and you have seen that the study is adding something new, and that the research question that they are asking is appropriate and is of a certain, it is an appropriate question, now you ask yourself, is the design they have come up with to answer this research question appropriate? Now, certain study designs come with inherent biases. Because there are two types of bias. There are those that we call random errors, and then we have systematic biases. Random errors are those that cannot affect the study in a substantial way. So you can still go ahead with the study. But systematic bias are those that come with certain study designs. So if the study methods that you chose address the most important potential sources of bias so that you minimize systematic bias. Because systematic bias, unlike the random errors, they usually influence the results of a study. Now, the sixth question is that there is usually a certain protocol that has to be adhered to. For example, when I did a research some time back, it was an interventional research, and we were having rats, and that rats are of a certain number grouped into certain groups, and each group has a certain number of rats. And for each rat, you have to give MSG, and that MSG, you have to give them at a certain time, and then after 30 minutes, you give a remedy. So you see that protocol was the protocol that was originally performed by somebody. So when I came up with my own research question, and I decided that my study design is going to be an experimental study design, I now asked myself, what protocol am I going to follow? Am I going to follow the protocol that the initial person used, or am I going to modify it? And for whatever protocol I follow, I have to justify that. So if a research paper you are reading is not following a certain protocol, then that is a red flag. Or if it has deviated from that protocol and it is not justifying that, that is a red flag. Now, does the study test any hypothesis? Because an hypothesis tells us that you have already started thinking of what you expect. So you're asking yourself, for example, if it is a study on the relation between, let's say, obesity and HIV/AIDS, you have started asking yourself things like, does HIV/AIDS and the taking of the ARVs predispose to obesity? And then hypothesis, like for example, a null hypothesis will come like HIV/AIDS and treatment with antiretroviral drugs doesn't cause obesity. And then now it is when you have such an hypothesis that now you will be studying, you will be carrying out your research, knowing that you are either going to arrive at what the hypothesis is saying, or you're going to disqualify that hypothesis. So it is just an assumption now. It is good to have such. So if you are reading a research article and they have not stated any hypothesis, or it doesn't come out, then that is a red flag. Now, once they have come up with everything, a study method, and they have collected results, these results are numbers, or they are something that has to be analyzed. It is either qualitative that has to be analyzed, or numbers that have to be analyzed. So you have to come up with statistical methods to analyze this data. So the eighth question is, did the statistical analysis that were performed, were they performed correctly? If so, now they go to their conclusion, because when you now do your calculations, you analyze your data, you conclude something. So that brings us to number 9. Does the data that we are looking at justify what the author has concluded? For example, if the paper is saying that 80 people who are on ARVs developed obesity out of 100, the author should now correctly justify that HIV and use of ARV, HIV and use of ARV drugs causes obesity. So there will be no disagreement between the data and the conclusion. So that is what number 9 is saying. Now, it is very important to know that when this author or the principal investigator was carrying out research, there are some motives that we don't know that usually are around it. And for example, you can get a pharmaceutical company funding a certain research because they know once the results of that research come out, people are going to think that our medicine fights this disease and we are going to have a very huge market. So if you don't mention that that pharmaceutical company funded your research, you see, that is a conflict of interest. You have to mention that I was funded by this one, but I still had to you tell your relationship very well, because people will think that it is because it is a pharmaceutical company that is going to benefit. That's why they funded you. So any conflicts of interest have to always be declared, and that is one of the requirements. Even if your paper is, if you have a manuscript that you want to submit, one of the things that you must do is to declare conflict of interest. So that now finalizes about critical appraisal. Now what has remained is that small activity now that I wanted to do now. And I will just ask this, just give me 1 second. I'll just ask this question. Thank you. So I'm just projecting the paper. I won't share it, but we will be asking ourselves certain questions. Now, the question, the paper that we shared so that we critically appraised was the digital readiness and literacy for chronic kidney disease management among healthcare workers in Kenyatta National Hospital, Nairobi, Kenya. Okay, and I just wanted to ask my fellow students of the UON Research Club, or even you listeners, if I take a study design in which me as an investigator, I just discern subjects in their natural environment without me intervening or manipulating the study variables in any way. And the subclasses of this kind of research design are called studies, case control studies, and cross-sectional studies. Which study design am I talking about? Can you please write on the chat so that I know if you received the paper that we are supposed to critically appraise? Can I see answers in the chat? What type of research design involves the investigator just discerning subjects in their natural environment without intervening or manipulating the study variables? And the subsets are cohort, case control, and cross-sectional. In fact, the one that we wanted to go through was a cross-sectional study. So they are under which type of research design? I won't be able to see my chart. Okay, here I can see. Any attempts? Aha, Jessica Bule is saying observational. Any other attempt? Jessica Bule, you are right. So a research design in which the investigator just discerns the subjects and does nothing, doesn't intervene or even manipulate the study variables. In short, I changed this term, discern. There was supposed to be an investigator observed subjects. So I changed it to discern so that I see if maybe we know what an observational study is. Okay, now to finalize, this is now a summary that I got from PubMed of the key points if you are critically appraising a paper. Now, in our paper, it was published in a journal that is called JOCAB, Journal of Kenyan Association of Physicians. So, because one of our bullets is saying that you do an overview of the paper, check the publishing journal, the year that it was published, the article title, the authors, and the institutions, and then verify if in that journal, one of the requirements for publishing is a thorough peer review process before the paper is accepted. So once that is okay with our paper, you can tick the first bullet that we have done a general overview of the paper, and we seem to be on the right track. Now, when you are reading the abstract, you ask yourself, you evaluate the clarity of that study's aim. For example, the aim of this study was this was how he came. He said that chronic kidney disease poses a growing burden in Kenya. However, the preparedness of healthcare workers to adopt digital tools for its management is unclear. So I can tell that the aim of the paper has been clearly stated. And you can confirm that either now or later on by going through that paper. Now, look for a well-defined statement of questions focusing on participants, interventions, comparisons, outcomes, and study design. If you go to the methodology, the objective, what they're saying that this study assessed digital literacy and readiness among healthcare workers managing chronic kidney disease patients in Kenyatta National Hospital. Because they are already focusing on the participants and what they are going to do. Okay, so I hope for those that read the paper, we are resonating well. Otherwise, you can always go read it later on and try and use the slides to compare now and see if you can critically appraise that paper. Yeah. Now, for the methods, you have to examine the eligibility criteria in the sources of information, the search strategy. For example, if it is a randomized, if it is a systematic review, for systematic review, you have to search articles, and then the selection of the study of the process, the data extraction method, and the risk of bias assessment. So far in this paper, I've seen that data was collected from healthcare professionals, which means, and they were using questionnaires, and the questionnaires were stating what was needed to be known from the uptake of the readiness and digital literacy of these healthcare professionals. Only those who are managing chronic kidney disease patients. So you can still see that the summary goes to the results, to the discussion, to the funding. Funding is very important, like I mentioned earlier. You must investigate the source and the role of these funders. For example, if I just benevolently fund a research, that is allowed. But if I fund a research because I am a pharmaceutical company owner, so that people come and buy medicine later on, that one brings a conflict of interest somewhere. Okay. And also, you can do other additional considerations. And with those those are the references from where I got my information. And I can tell you guys that thank you so much for listening attentively. And I'm here to take any questions. Either somebody unmutes and ask a question, or you type in the chat. Yeah, I'm currently looking at the chat. Hope I did not break along the discussion, or you didn't lose me.
No, that was excellent. So thank you for giving that presentation. My question is just in terms of funding. I didn't know if you
Yes.
saw it on this paper, but I was just curious, where do you usually find that information for funding?
Okay, so for the information for funding, usually once the author has discussed the paper and has concluded, after concluding now, those things like recommendations for future studies come. After the recommendations, what comes is now the conflict of interest, and then any funding. And if maybe they used AI or anything, they now mention that use of AI. And then if maybe they haven't provided, or maybe if sometimes you can look at a paper, then you see they have some nice MRI images, and you see that maybe the ones that are in the paper have been edited and all that. So you want the original ones. So data availability. So they have also to state that. So they usually come towards the end of the paper after the discussion and immediately before. Hope I answered your question. Isabella, did I answer your question?
It did. You cut out just a little bit at the end, but I think I got the the important bit where you kind of look after the conclusion, and usually you can find
Uh,
it typically under that portion of the
yeah.
paper. Yeah. But
So it
thank
is
you. I appreciate
between before the references.
Okay, before, yes, before the references, yeah.
But I have
All
seen
right.
that in this paper that we were given to critically appraise, the author did not provide funding, source of funding, which means he didn't want to disclose, or maybe it was personal. Any other question or concern?
I was gonna kind of add a little or ask a question kind of related to this, but in general, for I guess in the Kenyan medical education, what is the expectations with like critically appraising articles? Are you expected to also be involved in research pretty early on and write papers as well, or kind of where does this fall into your medical education? Is it something that some students choose to do, or is it kind of more mandatory that you have to write papers throughout your training as well?
Okay, thank you very much, Eric Wang, for that question. And for me to answer that question, we can before appraisal. You can do all that you asked. Number one, you can just critically appraise because you are just a student. Let's say you are a medical student who is trying to read about diabetes. So as you are trying to find papers, it is not every paper that will tell you about diabetes the way you want. So you will be critically appraising this paper so that the one that you are going to read about diabetes is the one that gives you the information that you want. That is as a student. If you are a journal editor somewhere, you will be doing it under what we call peer review. So when people submit their papers, the first thing is for you to review it. And for you to review it, you have to critically appraise it. So if all those things we've talked about are not appropriate, if the paper is raising so many red flags, you do what we call rejection, desk rejection. But if it is raising, let's say, two or one or sometimes maybe three red flags, you can send it back for the author to go and correct that and then resubmit again. You get that now? Now, let's say you are a doctor who is about to, let me give an example of Ben Carson. When they were about to surgically operate on the Siamese twins, yeah, he notes in his book that it was one of the first procedure to be performed. Yeah? So if it is one of the first, you will really want to read a lot of papers around that subject before you move on with the surgery. And when you are reading so many papers, there are millions of papers outside there. You don't want to waste your time just reading. So for you to save time and just find some few relevant papers, you have to critically appraise so that by the time you get a good paper, you can rely on that information. Okay. So it is multifaceted. Anybody can do critical appraisal. And that is even why we are trying to discuss and learn about it so that from today you can even start doing it if maybe you want, and you can even consider doing it as a journal editor. Eh? So you can do it as a student, as a doctor, as a researcher, and as even somebody just looking for knowledge. Thank you very much for that question. I hope it is answered.
Thank you, John. I want to be mindful of everyone's time because either you're getting ready for bed potentially or you're getting ready to start the day. And I know we have students preparing for exams. So I want to say thank you for everyone who were able to come out today. We hope to do potentially more events in the future, maybe do some more collaboration. But again, I want to say thank you for everyone who were able to make it out. Again, you can reach out to me if you have any further questions or to Faith, who helped put this event together. So thank you.